All right, hi guys, thanks for joining me and watching this video. If you've taken one of my courses, this is kind of what we reviewed about dynamometry. Really just for the hip right now, but this part of the video is pretty universal across all handheld dynamometer testing. So what I have right now is a microfet. This is a pretty common dynamometer a lot of people have, but the main thing I want to go over is what makes a make test and what is a break test. So make test, they're going to go ahead and so Stacy's going to do an abduction test. So she's going to turn on her side, legs straight, and a make test. So Stacy, what I want you to do is you're going to go ahead and when I say go, you're going to push up into this device as hard as you can, okay? So what I like doing right here is having my hand ready to support her so she's fully rested. Go and rest, Stacy. Good. And then I'll have it right here. So when she pushes into it, I'm secured and she's ready to go, but she's not just like holding it up there and these muscles aren't firing off. All right, so I'm going to hold it here, and on the count of 3, I want you to push in as hard as you can. Okay, ready, and go. 1, 2, 3, and rest. And then it'll give me the measure here, and then I'll go ahead and record it. A break test is when I overcome her force. So this time, same idea. I'm going to have it here, and I'm going to say, all right, Stacy, we're going to go ahead. You're going to hold it here, and I'm going to push down to try to overcome the force you produce. And then I'm going to record the force that breaks, of her braking, essentially, okay? So we're going to hold it here, ready, and go. Push, push, and good. A little bit of rest. One more time, and go. Come on, Stacy, push, 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 and rest. Good. So both of those tests, we want to make sure we're cueing the athlete and motivating them to push as hard as they can. With handheld dynamometry, it's going to sound like someone's going into labor in your clinic because you're just saying push, 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 push. Notice for the make test, I'm going to try to do like kind of a pulling movement for this. So I'm going to try to have my hands in that vector of gravity, and then I'm going to have her push up and then rest. So that way it's not much work on me versus me trying to do this one. You're fine to do that one, but you just have to have a high-low table. You have to get your arms in the right position. The other thing too is, again, just making sure if there's pain. So go and push against me, Stacy. Push, 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 and just drop your leg. If she just lets go because of pain, I can catch it pretty quickly. For the make test, or sorry, for the break test, notice with here, go and hold here, Stacy. Notice I'm just not going to try to power through it. I'm going to have this right when I let go. I'm going to keep this device in my body, and then I'm going to actually use my body to kind of push down that way. You're going to work with a lot of different size people with different strengths. So you want to make sure you know how to handle that position, and you save your arm, save your back, make it easy for you. When you're using those bigger muscle groups, it's going to be a lot more consistent too as far as you pushing down. So that's some advice on positioning. That's some advice on make or break test. If you took the course, it'll explain decisions on why you should use a make test versus a break test. It'll show reliability, but that's out of the scope of this video. This is more of just instructional things on cueing, positioning, and explaining make or break tests. Thanks.